Hello, welcome to Cedar Recovery. We're an American Society of Addiction Medicine Level 1 outpatient treatment facility that specializes in treating substance use disorders with a primary focus on treating opioid use disorder with medications such as buprenorphine and naltrexone. Under the leadership of our Chief Medical Officer, Dr. Stephen Lloyd, our Chief Clinical Officer, Trent Hughes, and our Chief Executive Officer, Joe Bond, we have had the opportunity to treat thousands of patients over the last 6 years with these interventions. Our goal is to help people feel better, get better, and stay better, and ultimately enter long-term recovery. We'd like to give you a tour of our facility and show you how we do things and what we do to help these patients out.
We would now like to walk you through the flow of a typical patient appointment. When a patient presents to one of our offices, they are immediately greeted by friendly and welcoming staff to help them through the check-in process. After the check-in is completed, a medical assistant shows the patient to their room where they will be seen by a physician and a counselor. In order to provide an appropriate assessment and quality ongoing care, our providers must have as much information about the patient as possible. This includes the detection of prescribed and non-prescribed substances. This is accomplished through urine and saliva drug testing. Upon completion of the test, a patient is brought in for additional testing regarding communicable and infectious diseases such as hepatitis C and HIV. Those comorbidities may be present in individuals suffering from a substance use disorder, making it imperative to treat that, such as in the case with hepatitis C, or make a referral to a specialist. Upon completion of laboratory testing, the patient is seen by one of our medical providers. This may be a physician, a nurse practitioner, or a physician assistant. During this phase of the visit, the patient is evaluated and prescribed any indicated medications for the treatment of their substance use disorder. These medications may include buprenorphine, naltrexone, or other medications to help suppress cravings and stabilize the patient. After the medical provider has completed their portion of the visit, the patient is then seen by a licensed therapist to provide individual counseling services. We believe that access to a medication and access to treatment are not synonymous terms. It is absolutely imperative that a patient receive behavioral interventions in addition to any medication that is prescribed. We also offer group counseling to all of our patients. These groups are offered every hour on the hour. This helps ensure an ease of accessibility for counseling services. Most groups consist of 4 to 12 people and allows for an open and welcoming environment. The COVID-19 pandemic has affected access for patients in need of these services. Fortunately, telemedicine expansion has allowed us to reach patients not only that are concerned about COVID-19, but also for those that are in hard-to-reach areas such as rural places. After the patient has seen both a medical provider and a counselor, they are taken back to the front where they are scheduled for follow-up visits. This is where lives are changed. Through our medical and counseling interventions, we are able to help patients feel better, get better, and stay better by providing addiction treatment that works.